Hi there, I'm Dr. William Stiles talking to you today about erectile dysfunction. Erectile dysfunction, very common. In fact, it affects 30 million guys in the US. And of that 30 million, only 10 to 20% of guys seek treatment. So that's for a lot of different reasons. Sometimes guys just don't want to go in the office for it, or they just don't put an importance on it, or whatnot. But only 10 to 20% seek treatment. So a lot of guys dealing with this, in order to understand a little bit about erectile dysfunction, it's important to know a little bit about how the system works. Everything starts typically with sexual arousal in the brain. And so there's arousal in the brain that is then transmitted through the nervous system all the way down into the pelvic nerves that control and give sensation and nerve function to the penis itself. And when these pelvic nerves are stimulated, there's a release of nitric oxide. Nitric oxide then infuses into the smooth muscle cells of the corpora cavernosa, the spongy tissue of the penis. And there's smooth muscle dilation, including the arterioles, the blood supply that feed the penis. And in doing so, there's increased blood flow. And so when you look at a penis here, there are two inflatable rods. These are called corpora cavernosum. And there's a tough layer around here. Tough layer. It's called the tunica albuginea, which is the tough covering around these corpora cavernosa. But what happens with an erection is there's dilation of the smooth muscle and increased blood flow of this area here. And so blood rushes in, and when blood rushes in, there's vein. When the blood rushes in, the veins are compressed, and so there's more blood flow going in than there is coming out, and that's a typical erection that you'll see. Anatomically, that's what happens, but guys that come in with erectile dysfunction, they can be coming in for this end result, but it may happen anywhere along this spectrum. It may be a central nervous system problem. It may be a nervous system problem. It may be down here, more in the algorithm, where there's not enough smooth muscle relaxation and increased blood flow. So there's a lot of factors that can play into erectile dysfunction. Now, when you look at the numbers, maybe 20% of guys will have brain involvement or mind involvement. This is called psychogenic ED, and then 80% will have the rest of this, which is some other type of organic dysfunction. So as a urologist, you want to walk through this, and just by taking a history and an exam and by usually checking some lab work and things like that, you can rule out a lot of this thing, and you can see what you're dealing with as far as what are the possibilities that are off. And then once you know the things that are not working as well, then you can, target your therapy. But there are a couple of things that every guy with erectile dysfunction should do or not do. First thing, you gotta stop smoking. Now, as a urologist, I see a lot of guys that come in with erectile dysfunction, and they're smoking 2 or 3 packs a day. And that's the first thing I say is, we can do this workup, we can check your hormones, we can do all this stuff, but unless you stop smoking, you're going to always be fighting, because what happens when you smoke, the nicotine causes vasoconstriction. And when there's vasoconstriction, there's less blood flow to the penis. So one cigarette can decrease the blood flow to the penis or a finger by 30%. That's one cigarette. So there's a big effect to vasoconstrictors of this area because they inhibit the blood flow going into the penis. So this is something that overall, if you're smoking, it's something that is probably contributing somewhat to your erectile dysfunction. So this is something that I talk to my patients and say, hey, look, that's something that it just makes sense that if your erections are that important, you're gonna have to stop smoking because it's likely what is affecting a lot of this problem. And then looking at someone's medications. There's a lot of different medications that can contribute to erectile dysfunction. Things in particular, or any antihypertensive medication, like a blood pressure medicine, that's known. They're known because they alter the blood pressure and things, they can affect erections. So, if someone is on 4 or 5 different blood pressure medications, and they come to the office, that's something that usually we'll address, and not that they need to come off of those. It's something that if they can try something different or whatnot that may be less, sometimes their primary doctor can put them on different medications or take them off of certain blood pressure medications with better diet and exercise and things like that. So medications are something that can cause erection trouble. Hormonal deficiency. So there are hormonal issues like testosterone, that if that's low, that alone can cause some of this erectile troubles. It's important to know, sometimes checking that, you also check for, rule out diabetes or hypothyroidism. You also would rule out hypercholesterolemia sometimes. So there's a lot of different things that you want to look at to try to help someone with erectile dysfunction. That's a brief overview. I'm Dr. William Stiles. Thanks for watching urologyanswers.com.